Art is something which you indulge yourself in doing rather than you do it for the sake of doing it. There is also a misconception of how to do this exercise. Remember, however good the exercises are, maximum number of musculoskeletal injuries are because of wrong way of doing exercises. If your muscle is stronger, the strain to your ligaments are less. And if your ligaments are stronger, your strain to the cartilage is less. So there is no difference for every step you take more than 7,500. But there can be wrong workouts which could cause dysbiosis. Bones are meant for sternest jobs. It is meant for weights. So if you have more weights, the bones become much stronger. The much earlier you go to bed, earlier you wake up in the morning, probably that's the natural most way which you could live a healthy sleep-wake pattern.
Welcome, Doctor, to another episode of our interesting chat at Health with Rashmi. So today I'm going to be asking you about, something which is very frequently talked about. I myself have crossed 40, and everybody tells me that after 40 it's absolutely mandatory to do weights for a woman, especially because she will be experiencing menopause within the next decade. So, what is the impact of physical activity and exercise on health, specifically on lifestyle diseases?
When you talk about exercises, irrespective of the age, we'll keep it like that. Age is just for understanding what to do when. For that, we can add age as a component. But generally speaking, physical exercise is a very compact and very integrated part of your lifestyle. I would even call exercising as an art rather than an activity. Why do you call it as an art? Is because you'll have to enjoy what you do. Art is something which you indulge yourself in doing rather than you do it for the sake of doing it. You don't have to make it as a mandatory task to do it, but you have to enjoy what you're doing. The most commonest form of exercise, what we all know, is three. We can divide exercise into three categories. One is cardio, the second is stretching or flexibility exercises, and the third is weight training. There is also a misconception of how to do this exercise, which exercise to be done when and how long. Okay? There are theories, there are researches, there are concepts which actually define different forms of exercises for different categories. First, we'll take stretches and mobility exercises. So, your activities like your walking, your Zumba, your stretches, your knee touches, all these things comes under stretches. Why do you call it as stretches? Is because the exercise which you do on a morning is after a good night's sleep. For instance, if you are sleeping for about 6 to 8 hours a day, your muscles are become relaxed and they are all in one position because you don't keep changing your sleep positions very often. So when your muscles are fixed to one position, putting those muscles to strain immediately after getting up first thing in the morning is going to put more strain on the ligaments and the muscles rather than helping it. So I would recommend to do a lot of stretches at the first thing, at the very outset before you do an exercise. And every day's exercise should have all the three components incorporated in it. There should be stretches, there should be cardio, and there should be weight training. The amount varies upon different things what you do. I'm not talking about footballers or cricketers or sportsmen or general people. I'm talking about a very common society, people like you and me. When we have a normal job to do, if we have to move physically, what all we should do. So first emphasis on stretches. Stretches can be two different things, like the stretches which they teach you at school, where you put your hands up, hands down, wrist movements, leg movements, knee movements. The basic understanding of stretches is that you mobilize every joint in your body. Joint is a connection between one part of the body to the other part of the body. Right from your fingers, your wrists, your elbows, your shoulders, your neck, your back, everything is a joint. So you should be able to have a routine. It can be any way possible. You can start from the feet, you can start from the head, but you should have a routine where you mobilize the joint stress-free, which means you don't have to do a very rigorous mobilization, but a very soft and targeted mobilization of all your joints. Once this is done, you'll have to put yourself through cardio. Cardio, there are lots of confusions in cardio, like how much cardio is good for you. I would say if you're a middle-aged man or women, I would not recommend more than 20 minutes of cardio in a day, which is, or you can even amount it to 153 minutes of cardio is what the Oxford University says. But let's keep it to 160 minutes of cardio is about 2 hours of cardio in a week. which not even amounts to 20 minutes a day if you're working out every day. There is no hard and fast rule that you should work out every day. You should at least work out maximum number of days in a week. And the third component is your weight training. Weight training is for endurance and muscle mass and strength. Why weight training is more important as you age is because the bone density, the mineral density of the bone is directly proportional to the amount of weights you work out. So once you start doing workouts with weights, your bone and muscle endurance increases, so your longevity increases eventually. So 3 components of exercise is stretches, cardio, and weight training. If you do wrong in any of these things, you are prone for injuries. Remember, however good the exercises are, maximum number of musculoskeletal injuries are because of wrong way of doing exercises. Musculoskeletal is muscle, skeleton is the bone. It includes your ligaments, your muscles, your cartilages and bones. They are all weight bearing substances. So imagine if you are about 80 kgs, your knee joint is going to put almost 60 kgs of load at every time you stand up and you walk. And if you take an example of a knee joint is made of 3 bones. One is, in fact, 4 bones. One is the bigger bone called the femur, an equally bigger bone called the tibia, and there is a smaller slender bone called the fibula, and there is a patella, the kneecap. All these things form a joint. And all these things are independent components. They are all lying in the air. They are all suspended in the air. And they have to be connected via substances.
Welcome, doctor, to another episode of our interesting
an
chat
elastic
at
substance,
Health
like
with
a
Rashmi.
rubber band. We call it as ligaments.
So today I'm going to be
there are
asking you
cruciate
about
ligaments, cruciate
something which is
in medicine, everything
very frequently talked about.
Named.
I myself have
names,
crossed
which
40
means
and
it indicates the
everybody
work they
tells
do.
me that
So
after 40
is
it's
how it
absolutely
appears. So it's a
mandatory to do
cross-shaped
weights
ligaments, and
for
there
a
is a
woman,
cartilage, which is
especially
a rubber,
because she'll
which
be experiencing
increases the
menopause
cushioning
within the
effect
next
when
decade.
the joint is put
So
to wear
what
and
is the
tear, and there
impact
is a
of
muscle.
physical
So if
activity
your
and
muscle is
exercise
stronger,
on
the strain to your
health,
ligaments are
specifically
less.
on
And if your
lifestyle
ligaments are
diseases?
stronger, your strain to the cartilage is less. And if your bones are stronger, the surface of the bones are maintained. So it is the responsibility of everyone to take care of all the joints and all the components of the joint. So weight training, cardio, and stretches. I see a very common trend with patients who are diabetic, especially say I walk for 5 kilometers, I walk for 2 hours in a day. That's all wrong. You are tearing and wearing your joints too much by stepping so much of steps into it. There's a study which was done in Japan when it's related to your smartwatches everybody has. It counts the number of steps you do.
I was just about to ask you that,
Exactly.
that everybody has a target of 10,000 steps
Yes.
now.
10,000 steps was actually a misnomer. Like, it was just a casual discussion with somebody who said, probably in Japan, they said, 10,000 steps is good. Have you done your 10,000 steps? So that became a pattern, that became a religious following standard, that everybody talks about 10,000 steps. There was even a study which was conducted which says that the number of steps which involves the reduction in the deaths is no different from 7,500 to 10,000 steps. So probably they say if you do 2,500 steps, the research says that 2,500 steps, probably your death rate is much higher. If you push it to 5,000 steps, it was lesser. And the maximum optimization was reached somewhere around 7,500 steps. So there is no difference for every step you take more than 7,500. And now it's not important that you have to fix it to 7,500 steps. I would personally recommend that you have a target of about 20 to 30 minutes of cardio. It can be walking. If your muscles and the ligaments are strong enough, you can go jogging. And if you're overweight, there's another problem. See, if you're about 80, 90 kgs, you don't strain yourself by jogging, you start with walking. Once you come down in your weight, once you know that you're not putting too much load on your joints, then probably you can start jogging, you can start running. And jumping and skipping is also a very good cardio exercise. Swimming is a fantastic exercise. If somebody is worried about joint wear and tear, if somebody is worried about pains in the joints, swimming is a beautiful form of cardio exercises which does not have any impact on the weight, on the joints, is because you're on buoyancy. So the more you float, the much lesser it is, and it increases your lung capacities. It gives much increase in oxygen flow and carbon dioxide excretion, and it's a fantastic form of cardio. If it is not possible for you to swim, then the best exercises I would recommend is to go for a walk. And the walk should be a semi-brisk and a semi-peaceful walk. You don't have to be very lethargic and slow walking. You cannot be very brisk and swinging your arms and walking. You can have a moderation in between this and do it for about 20-30 minutes. And once you come back, then you do the stretches again, and then you go for weight training. Weight training, the most important factor about weight training is you're not going to have a bodybuilding weight training effect. The weight training is to increase the durability and strength of your muscles. So you have to quantify how much your body is able to tolerate, and then you'll have to increase. If you want to put weights, you have to increase slowly. It has to be a very gradual process. Baby doesn't grow overnight. So your muscles also doesn't grow overnight. If you increase your stress with heavy weights at a given load, the cardiac output suffers a lot. And if, God forbid, you don't have any problems, it's fine. But if there was a hidden block in your arteries and then you suddenly weigh about 30-40 kgs and then you pull it up, and that's when most of the people die in the gym. You have seen so many videos and news where very young people who don't know the heart health, they just do a strenuous workout and then they pass out there. So that is a biggest risk what everybody has if somebody is around 40. It's always good to know your cardiac health before you go and join a gym.
Doctor, in the last week alone, I have met two of my neighbors who have told me that both active, very healthy, mid in their 40s, and both told me that they have developed a disc compression through workout. So, is it because of this?
If it cannot be purely because of a workout, but there can be wrong workouts which could cause disc bulges. See, disc is nothing but, like I said, it's kind of a rubber tissue. It's kind of a cushioning tissue which is in between two bones. So the bones are lined one after the other. And imagine if two bones come in contact, two rough surfaces come in contact, it's going to cause more wear and tear. So naturally there is a small rubber, dewy kind of substance, jelly kind of substance in between this. And especially when it comes to your back, your spine, there are about 33 spinal bones and there are cartilages in between them. And through them, the spinal nerves comes out. So what happens is this spine helps you in flexibility and keeping you straight. We are all erect human beings is because of the muscle which is surrounding the spine called the erector spinae. The name suggests it keeps your spine erect. What happens is when you're in that position, the disc helps to reduce the strain between two joints. Imagine if you're bending down and then pulling a heavy weight without the proper method. What happens is the load has to be distributed all through your joints, your muscles of the back, and then come to your lower back. Imagine if you just pull it straight up and then you give more load to this. The disc which is like this in between two bones and it slips. That's what we call the disc slip. And if the disc slip is very early and if it is not touching the spinal lining, then it's fine. It's not going to cause you much of a difficulty. But if it touches the nerves, if it compresses the nerves, then we call it as a disc compression and radiculopathy, which is called the neuropathy, or the nerve is involved when there is compression of the disc. So there are stages for that too. Is there a way to do it properly? You have to get a good trainer, and the trainer should know. It's like giving all the information to a doctor. You have to get a trainer who knows you very well, and you have to give all information to the trainer. And ask the trainer not to push you into anything at all unless and until you know you're strong enough. So these disc bulges are not very common, and I would say the risk involved in doing weight training is this. If you don't do it properly, you will injure yourself and cause musculoskeletal injuries. And there can be very grave emergencies because of these injuries as well. Imagine if the disc completely cuts it off and then cuts the spinal cord, then you could get paraplegia, you could get no sensations below your hip, and there can be constant pains. We attribute it to nerves, sciatic nerves, peroneal nerves, and all these things would cause it. So it is always good to know how much you can tolerate, how much weight you can get it. Muscles are like your heart. I always categorize muscles and heart to our pets, like a dog. You can train it, but you cannot completely rely on it. So which means you have to train it constantly. If you ask your dog to sit, if you train it properly, it'll sit. But if you don't train it properly, it's not going to listen to you. The same is good for your heart as well as for your muscles. If you train your muscles properly, it's going to listen to you. If you don't train it, the muscles will go its way. You will be thinking you're doing something else and you'll damage it.
Doctor, for someone like me who's crossed 40, weights are important. So, building weights help build muscle mass, weight training?
Yes.
And how does that impact my menopausal transition?
Weight training, there is again, the physical therapist is the right person to tell you how it is worked. But what I'm trying to tell you is weight training has two components in it. Weight training can be for endurance and it can also be for muscle mass. If you're having too much of weights, if you lift too heavy weight on a slow repetition, your muscle mass is increasing, muscle bulk increases. But if you want to tone your muscles, if you want to endure your muscles, smaller the weights and longer the repetitions. For instance, if you have a 5 kg dumbbell and you want to create a biceps, you want to increase the mass of the biceps, you want to increase the bulk of the biceps, I would say 5 kgs, slow repetitions. But if you want to strengthen your biceps, same 5 kgs you can hold it, but reduce the weight to 2 kgs or 3 kgs and then repeat, say about 20, 30, and then you repeat the reps again and again. This increases the endurance as well as the muscle mass. What happens with your question about longevity and muscle mass is that there is a study which says that if you cross about 50 or 60 years and if you have a good muscle mass, then it is directly proportional to your longevity. And so is your bone strength. We call it as the bone mineral density. The bones are meant for strenuous jobs. It is meant for weights. So if you have more weights, the bones become much stronger and the muscles protect the bones and the bones protect the muscles. So your structure and frame becomes much firmer so that you don't get osteoporosis. The commonest problems with women after about 40 or when they cross menopause is osteoporosis. The bone mineral density falls down like this and the bone becomes very porous. So when you do weight training, obviously the muscle mass increases and the osteoporosis is delayed. I would say, yes, to a certain extent you can even stop osteoporosis. You can bring in more strength to your bones by working out.
Doctor, what is the role of sleep in your physical fitness?
Yeah, that's a very good question. The sleep is a very integral part of human or animal or any living being. The sleep plays a major role in shaping your hormones, shaping your stress levels, shaping your environmental adaptability. No, we call it a rhythm which is inside your body called the circadian rhythm, which gets altered when you travel to different time zones. When you probably fly to a time zone which is more than 5 hours, or about 10, 11 hours, you get a completely different sleep and wake patterns because everybody there are used to the sleep patterns which is there in relationship to the sunrise and sunset, and we'll have a different pattern. So this kind of rhythm is called the circadian rhythm, and this rhythm is kind of an inner clock. It runs every minute inside your body. The problem with sleep and regulating sleep is important is because what study says of what we understand ourselves is about 6 to 8 hours of proper sleep would give us more healthy life rather than a shorter duration of sleep. But how to achieve this sleep is another problem. And even though there is no relationship between exercise and sleep, but the way you exercise is going to put your muscles and your body into a state of sleep at the end of the day. If you start working out in the morning, you need some time to put all your muscles and your mind to at ease, which is sleep.
So evening workouts are not the best.
Evening workouts could be best, but most likely the evening workouts are going to cause more tiredness rather than sleep. So I would say the morning workouts are the best, but if you don't have time, at least workout is good. So any time of workout is good, but as far as I personally prefer, morning workouts are better, and then sleeps are better in the night. And we also have an opinion about the sun rays and sunset pattern. It comes with diet as well. So when we always advise that you eat when the sun is up, and then you don't eat anything once the sun is down. And once the sun is there, You do all your physical activities, all your jumping around, going around, working. And once the sun goes to sleep, it's time for you to go to sleep. Which obviously means when the sun gets up, you should be able to get up. We don't know if the sun rises at 6:30 in the morning or 5:30 in the morning. Whenever the sun is up, it's customary that you get up when the sun comes up and do all physical awake activities when the sun is awake. And then when you go to bed, you do all pleasurable things when you go to bed. So normally when the sun sets, you have a nice meal, you sit with friends, you sit with families, you chat, you go to sleep, you have fun. That's during the night. So this is how your pattern should change. But given today's circumstances, when works are different, when people stay in one place and work at different time zones, it might be difficult. But still, if you could find a fantastic window of 6 to 8 hours of sleep, that is going to be an elixir of life, I would say, by secreting hormones which are all good for your body. They are called opioids, are secreted when you sleep. Happy hormones are secreted when you sleep, and all these hormones keeps your rhythm and your heart rate and your body at a very peaceful and a very calm state.
So, do women require more sleep than men, or 6 to 8 hours is just a rule of thumb?
Generally 6 to 8 hours of sleep is what is advocated, but it is individualistic. There's no men. Women do slightly need much more sleep, but generally that's not the habit what happens in at least this part of the world. But it again depends on how well you manage your day and how much of sleep is required for you. They even say 6 to 8 hours sleep is a blind sleeping pattern. If probably somebody goes to bed at 2 o'clock in the morning and then gets up at 10 o'clock when the day is bright, it's not going to produce all those happy hormones which is expected to be produced because of sleep. So I would say the much earlier you go to bed, earlier you wake up in the morning, and you try to align yourself with the sun. Probably that's the natural most way which you could live a healthy sleep wake pattern.
Doctor, I read that teenagers tend to have a shift in their sleep cycle for up to 2 hours.
Yeah.
So, this is something I noticed with my son also. Over the last year, he falls asleep only by 11:30. And when does this regularize?
No, this 11:30 problem is because of the way they study, the social media, the mobile phones, the tablets and stuff like that could be a major cause. But generally kids sleep a longer duration. That's what a newly born baby sleeps most of the time. It just wakes up for feeding. That's when your neural tubes grows, your nerves grows, your brain grows. That's what we all understand. So sleep brings in a neural development in the child. So as age advances, the sleeping pattern of the child slowly decreases, which means if a baby sleeps about 20 to 22 hours a day, it's mostly in the first year of life. As year passes, as the baby becomes more aware of the environment, more visual, tactile and sensory communications come into it, the sleep pattern slowly reduces. And teenage is one factor which hormones play a major role, because there is a sudden rush of hormones into the body which body even doesn't understand why it is happening. So in those periods the change of circadian rhythm happens, and there could be an alteration in the sleep pattern. But necessarily it need not be exactly 2 hours or 3 hours, but there is definitely a reduction in the sleep pattern. But still, the adolescent and adult age groups are not big different from what it is required in terms of sleeping. So I would recommend not to stay too much long into the night, and especially the dopamine effect which comes because of the constant change in visual sensory communication is a major factor which keeps us awake. So these hormones keeps us very active and very vigilant during the night, which actually puts us into a...
So, essentially, social media scrolling is not to be done.
Yes, not to be done. Preferably done little earlier during the night, which is if probably somebody wants to eat at 7 o'clock, the dinner, early dinner, and then early scrolling or early seeing, and then by 10 o'clock would be an ideal time. Given this day, 10 o'clock would be an ideal time to go to bed. So waking up cycle would be much better. So they can have their own time when they get up in the morning, so they don't have an urgent morning. Because most of the kids, like I said, if they travel too long for their schools or colleges, they have to get up much earlier, and they get anxiety when they get up in that state of mind. So early sleep could actually give them an early window of getting up, and then it gives much better easing out on their morning blues.
So sleeping well essentially helps you produce more good hormones.
Yes.
Would you say that this has an impact over the concept of mind-made diseases as well?
Definitely, it's obvious that they are called happy hormones for a reason, because it brings in peace, it brings in happiness. Like opioids, they say even the natural most painkiller what a body could have is opioids. Even ages ago, maybe I would say about a few years ago, we thought opioids are good. Opioids are secreted only by the brain. But now we understand every cell has the capacity to secrete opioids. And opioids secreted at one particular state of mind when you're at peace. So sleep is something you can quantify it as REM sleep, NREM sleep, and all those things are too much detailed into it. But sleep as such is a fantastic phenomenon. And this natural phenomena causes all these good hormones. And what are these good hormones going to do? Good hormones are going to keep your body with peace. And when you get up with good vibrations, good senses, your mind is at peace. But like I said, most mind-made diseases, we may call it as lifestyle diseases, or we may call it as modern diseases, can be avoided if you have a fantastic sleep, a good eating habit, and a proper physical exercise.
Staying on the concept of mind-made disease, you spoke about, being able to identify certain patterns. Can you give us a bit of an insight on what are the patterns in lifestyle that have very specific outcome or manifestation in terms of physical diseases?
The mind-body concept is something beyond the understanding of, I would say, the human mind. Why do we call it as it's beyond the understanding is because it is more of a subjective pattern rather than an objective pattern. Because I am in a very not in a good position to guess what you are thinking right now. But if you ask me, the amount of thoughts which runs in your mind right now could be a cause for a disease in the future. So this holds good for everyone, you and me, and because everybody has a masked face, everybody has a mask of emotions. It's not that I'm not in an open book where I show all my emotions out to you. I have my own reservations, so I keep a happy face, but I might be having a very sad emotion inside. This is not easily understood by a person who is seeing you for the first time or in a third person's perspective. So mind-body concept can be difficult to be comprehensible, but it is true. I'll give you certain examples like I gave you for diabetes, where when there is uncertainty, when a person cannot decide or be strong and confident of the outcome, it more likely is going to cause diabetes for them. We will extend it to other diseases, which common diseases what we see in clinical practice. Okay, this we will leave it to the audience. If anybody has such diseases, they can correlate it and they can understand if that is true or not. The most common is the joint pains. Joint pains is like osteoarthritis. We call it as osteoarthritis is because when that rubber cartilage owns off and bone on bone, when bone rubs together, and then the bone degenerates, and then it causes lots of pain and difficulty in walking. What I attribute or what we commonly see with osteoarthritis is there is lack of support. We would give some examples of this. If an old lady about 60, 65 comes and says she's having knee joint problems, if it is the bone degeneration, then more likely that she has a problem with either her son or daughter or husband or anybody in the family who should act as a support to them. Do you know what I mean? If there is no support, probably their son or daughter is there in a foreign country and she's left all alone here to struggle. And that's when she thinks that there is nobody to support her. And most of those cases, they will have knee joint problems. They will have osteoarthritis. And if you add few more to it, like diabetes, the complication of diabetes is why I keep telling this mind and body complex is that not every diabetic patient is going to have renal failure. Not every diabetic patient is going to have a heart attack. Not every diabetic patient is going to have a stroke. But why is that only certain people go into cardiac problems, and why certain people go into a renal problem, and why only certain people go into a cerebrovascular problems? We may have medically, there are reasons. I'm totally agreeing with that. There is atherosclerosis, there is narrowing of the vessels, there is accumulation of cholesterols into the blood vessels. All these things are explainable reasons. But why the same thing is not happening to the brain and it's happening to the heart? If you say if there's a heartbreak, we call it as heartbreak. The heartbreak is you did something to me which I'm not able to digest, and I keep it to my heart and I cannot forget it. If I have diabetes or if I have a predisposing morbidity, I will have an heart attack. If there is a renal problem, if there is a renal failure is most common in hypertension. Stones are different. Stones will come back again. Renal failure, we call it chronic renal failure, where the kidney doesn't work. There is a sense of insecurity. There's a sense of insecurity. It can be because of properties, it can be because of emotions or life or threat. You are worried that somebody might take your property. You're worried that somebody might do something to you, or somebody might do something to your kin and kith, to your family. This kind of insecurity or a fear that is unknown will cause renal failures. Renal stones is like you're not able to produce these emotions out or produce these fears out. You have this fear, but you're not able to express it outside. You might get renal stones. So is normal with the tumors, with the tumors popping up, be it malignant, cysts and fibroids. Your emotions are controlled. Your emotions more towards your relationships. Like I would say, if it comes in the reproductive organs like uterus or the ovaries, then most likely you're in a strained, inexpressive relationship with your husband or with your spouse or your wife. This is actually difficult to quantify, but it is there somewhere. It has to be vented out. If you come back with thyroids is something, again, inexpressiveness. So you're not able to, you're finding yourself insufficient. Not in a wrong sense. You don't have to take it in a wrong sense. But if you have hypothyroidism, then your ability to do something is not recognized by people. It can be your close people, it can be your in-laws, it can be your husband or wife or whoever it is, who you value the most, you're not able to do it. And autoimmune disorders are very easy to understand, very easy to diagnose, is because it has a perfect mind behind it. People who suffer from autoimmune diseases are people pleasers. They, irrespective whether they know them, they don't know them, they are very close, not too close, they always don't know to say no. They will see face value, they will see that they'll think about all your emotions, and then they'll suffer inside. So this is a major cause for autoimmune diseases. And if you leave all these things and then you go back to common problems like peptic ulcers, GERD, or your irritable bowels and all those things which irritates you, you're having an anxiety, you're having an inexpressive, indecisive stress inside, which burns you inside. So which causes anxiety, causes inflammation. And liver problems all comes because of suppressed anger. You have anger, you have that rigorous emotion which you cannot throw it out. You put it inside, it goes into the liver. So likewise, you can devise major organ problems into your mind. But how well we connect with the patient is more important when you find out the disease. That's why I say the increase in blood sugar could be a cause. Could be the effect. The non-production of insulin could be a cause. The non-production of receptors could be another cause. But out of all these things, what creates this non-production of insulin, non-production of receptors, could be a mental cause. I'm not saying everything is a psychiatric illness. That we can classify them as psychosomatic disorders, but not pertaining to mind alone, not to the brain alone. It's not a psychiatric disorder. But this is an emotion. The reaction to that emotion is what determines the disease, the outcome of the disease probably. Even if you say not the disease, at least the outcome of the disease.
So you're saying, doctor, that one easy hack, if I may put it that way, to really have a healthy lifestyle or to prevent lifestyle diseases is to simply talk and find a safe space to talk.
Exactly. This could be communication is a much more. That's why most of the people
I mean, that's
who
so
are,
simple. I mean, it simplifies everything.
you have a problem with your husband or your wife, you go and talk to them. You make them, you stop them. Like I give you an example. Like you clean for your husband. You cook for them. You make all those lovely dishes what your family thinks. He doesn't even recognize. Rather than taking it inside, taking it deeper inside and suppressing it, why don't you catch him and say, I did this for you. Do you like it or not? So you need what you want. So you'll have to ask. We are in a world where people are lost in their own thoughts, lost in their own work, lost in their own profession. So it is the necessity of us to stop and then tell them what is the problem. Or you yourself identify what problem is this for you, and then you yourself talk to yourself. That is even much more easier for you. You don't have to worry about talking to somebody else. Stand in front of the mirror, talk to yourself. Find out what is wrong with you, find an answer, find a solution. I would again give an example of the outcome of a match, of a cricket match. You're not bound to have an outcome of a cricket match all because of you. So you don't have to take the blame. It is dependent on different factors, different people, and you live a match every single day. It's not that you alone play here. There are people around you, there are people in the environment. Everybody plays together. So the outcome is immaterial. The outcome can be positive, outcome can be negative. How well you accept this change is what is going to decide your disease or your state of health. I would put it like this: not rather than disease, we would call it a relative state of health, so that it is, if it is relatively higher in terms of health, then it's good health. If it is relatively lower, we'll call it as a bad health. But I would attribute most of the lifestyle diseases or most of the diseases to the mind. So if your mind is happy, you're happy.
This is really amazing, doctor, because I personally champion talking over anything else. And this is something I realized very later in life. And when I see a lot of young people today who do not want to opt for that talking, it's just sad to see them. I can just see that they're headed to a car wreck. It's going to be a car crash. And
Yeah, very well said. Communication is a key. Even in profession, I said, tell you, if you're not able to communicate yourself, then there is a problem in whatever you do. So, like you said, everybody is human. Everybody is people around us. So there is no necessity for being judgmental, and you don't have to worry too much about what other people think about you. Their judgments are not going to affect you as long as you don't take it inside you. Their judgments are judgments. If I draw a number 6 in front of you and me, it's going to look like number 6 for me and it's going to look like number 9 for you. Which one would you say is right? If I see it from here, it's going to be number 6, and you see it from there, it's going to be number 9. So I'm right from my perspective and you're right from your perspective. So that's why we don't get people to like everyone. So is with the movies, so is with your stars, so is with your hobbies, fashion, food, everything. There is an opinion. Whatever is right for me, whatever your mind at the right sense tells is right, you can do it. You need not be worried too much about the opinion of others. So when that opinion troubles me, I go into a conflict. And the conflict stays inside me, I go into a disease. But if I don't have a conflict, I don't have a disease. And if I don't have a conflict, I'm living in my own world. And there is another important concept, a very interesting concept called the expectation versus reality concept. We get lots of reels nowadays. Yeah. What is expectations and reality? The funnier side of it is yes. But the philosophical point of view is very simple. What is expected and what is achieved? So you might think that tomorrow you have to fly about 100 feet. And if you're able to do 80, you should be happy at 80. So the gap between achievement and expectation, if it keeps on reducing, your conflict is not there. If the gap increases, your conflict increases. If at all there is a circumstance where the gap can never be filled, you should be able to be in a position to accept that. If there is no acceptance, then the conflict persists. If the conflict persists, disease emerges. So it's kind of a vicious cycle. It may be easy to understand when we talk, but to put it in practice, it's going to be very hard. And we need a lot of understanding about yourself, retrospective understanding before you actually think about others. So I would say to every patient of mine, I would always advise them to think for themselves first, think why they are in a conflict, and if they are able to resolve the conflict, you would probably have a very healthy life.
Thank you, doctor. This was really insightful, and see you another time.